President-elect Trump is shaking up the U.S. health system with his pick for HHS Secretary Robert F. Kennedy Jr. Kennedy has vowed to make America healthy again. He has insisted he's not anti-vaccine, but he has a long record of making misleading statements about them. He's one of a growing number of people who are skeptical about vaccine efficacy and the impacts they may have on the vaccine recipient. Some parents are now questioning whether they will vaccinate their kids, and that's prompting concerns among health professionals nationwide. CBS News Chief Medical Correspondent Dr. Jon LaPook is here with me in Studio 57. Doctor, why are we seeing this increase in vaccine hesitancy, and what are parents telling you?
Well, there's been vaccine hesitancy ever since there were vaccines. Benjamin Franklin went to his grave regretting that he didn't give an early form of the smallpox vaccine to his 3-year-old son, Frankie Franklin, believe it or not. And he ended up dying of smallpox. So there's always been resistance, but, in the last 20 years, you saw it rocket up. And I think it really started in 1998. There was an article that was in the Lancet that linked falsely MMR vaccine, measles, mumps, rubella, with autism. That has since been totally debunked, shown to be fraudulent. There were 12 kids. The article was withdrawn. The person who did it lost his license. However, believe it or not, it took 12 years until 2010 for the Lancet to retract that. And in that time, it just spread. And there was this fear that, and it's since been shown in multiple studies not to be true, there was a fear that MMR, measles, mumps, rubella, caused autism, and it turns out that it doesn't. But think of all the time that was lost finding out what does cause it and maybe diagnosing it early. So we addressed this. Why recently, of course, during the COVID pandemic, you saw a decrease in faith in public health and in doctors in general. And so you're seeing more and more people, first of all, because they weren't there, they weren't able to get to the doctor's office and get vaccine, but also saying, do I really, really trust this? We addressed this in tonight's evening news story, and we spoke to one of the mothers who was having some questions. You're going to see it right here.
I started to get hesitancy in saying, all right, can we space these out? Because you're giving my child a lot in a visit, and the doctor kind of made me feel like, you're being dramatic, but okay.
Most people, when they come to the office, they're really concerned, most importantly, about their precious little one. And so it becomes really important for us as doctors to communicate the safety and the efficacy of these vaccines.
You hear some parents say, why do we have to have so many vaccines so soon?
The reason why we present infants with immunizations early on in their life is because their immune system is really susceptible to not only viral but bacterial infections.
So let's dig into this a little bit more, because tonight you also explore in your evening news piece this idea that kindergarten vaccination rates have fallen below the herd immunity level. Can you explain what that means and what the risks associated with that are?
Yeah, so herd immunity means that, and it's felt to be 95% is needed for herd immunity for these childhood vaccinations, that so many people have been immunized that even the people who cannot get immunized, and those are people who are too young, the MMR generally is not given until 12 months of age. People who are immunocompromised, people who have cancer, people who have compromised immune systems so that even if they get vaccinated, they don't get a good immune response. Those people are protected because most of the people are immunized, and so therefore you're not going to have as easy spread of the virus or of the problem. And we're seeing it going down to 93, and of course the problem is then these childhood illnesses can pop up, and we are seeing this happen. Mostly in pockets, even though it sounds like 93% is a lot, it's much lower in various pockets of the United States where people are especially hesitant to have vaccinations, and we're seeing these outbreaks of measles and pertussis, which is whooping cough.
Real-world examples of this theory. What does the process look like for federal agencies to approve and then recommend a vaccine?
So that's, of course, a big question coming up right now with the incoming administration. And, the CDC, the Centers for Disease Control, are the people who actually make the recommendations. They have a committee, which is an advisory committee for immune practices, that gives them advice. It's supposed to be sort of an independent process that sort of above them should not be putting their thumb on that and saying, look, this is what we want you to do. However, in real life, there could be intentional and unintentional pressures put on these organizations that can sort of push them towards maybe recommending it one way versus another. We don't know that that's going to happen, but that is one of the fears.
And then what is the process of changing or reversing a vaccine recommendation?
Yeah, well, the CDC has the say and saying this is what we recommend, and this is based on this independent advisory board, and this is our recommendation. Now, it's only able to be sort of formally reversed by the CDC. Whether people take it and say, that's what I'm going to do, that's a separate matter. And I think it's very hard for a parent to say, you know what, I do care about the common good, and so I'm going to go ahead and do something to protect the herd.
Right.
But that's what we've done for years, and we've been 95% or more. But now you're starting to see that sort of creeping down.
That's sort of the crux of the entire piece. I look forward to watching that on Evening News tonight. Dr. Jon LaPook, thank you.